Hello, hello, hello. This is Jenna Cantor, performer and physical therapist. I'm the founder of Powerful Performer, coming on to talk about a study. Want to get into information that is real, not just random stuff that you're hearing on the news where you don't understand the full background. So I'm going into details every time I talk. So right now I'm talking about a study, and let me even sum up the title here. I try my best to say this, but they looked at how a person steps down from a step. So like you're going a step, like a step on a staircase, a step. Okay. So they looked at how a person steps down with one leg from a step. They compared a person who has hip pain due to hip impingement. For those who have it, they would know what's called. It can be called, it doesn't necessarily need to be this, femoroacetabular impingement, or they compared to somebody who has hip pain for those who do not have hip pain. The people with hip pain specifically were people who have femoroacetabular impingement. What that means is right here, we got this is your pelvic bone, this is your femur. They go in like this. So let's go like this. So there we go. This is the pelvis, this is the femur going like this. I think that looks a little bit better. Okay, so right here we have either we could have a piece of the bone sticking out and it comes up and hits here, okay? Or there can be a bone. It's basically bone hitting bone, bone hitting bone, all right? I'm gonna get better at dumbing this down, okay? So, bone hitting bone, that is what femoroacetabular impingement is. It can be two types, or it can be a mix of the two types. What these authors did is they took, we got to look at the people first. They got 20 people who have this hip pain due to femoroacetabular impingement, and they compared it to 40 people who have no pain, okay? And they asked them all to do the same thing with stepping down from a step. And from this, the point where they measured the differences in how they are performing this exercise was when their knee was at 60 degrees knee flexion. Let me show you what that means. So if I'm bending my elbow here, this is 90 degrees. As I start to go out, it's going to be less degrees of the elbow flexion. So it's basically less, just a little bit less. So let's say this is 90 and this is, let me go back. This is 90, this is 45 degrees like this. So it's somewhere kind of in between there. All right, when they're stepping down though. This is at the knee, This is mostly because I do not want to stand. They compared these people, the ones with the hip pain, the ones without the hip pain. This was a case control design. I know, I'm throwing a lot of stuff at you. Write these things down, look it up, Google it. I'm just trying my best to give you this information. So a case control design means they have people who had something going on with them, the people with the hip pain, and then control the people without the hip pain. That's all, and they compared it. They knew who these people were, they placed them. It wasn't randomly like, oh, let's just grab people. That actually would be better. They didn't in this case. And what they did from this is they analyzed them all doing the exact same tests. All right, so the step down test. The results, they found the people with the hip pain were not as good as performing it. Specifically, they saw that the person had greater hip flexion. All right, I gotta stand for this. This is where I wore good pants. They saw when the person stepped down, they had greater hip flexion if they had the hip pain, or if they had the hip pain, they saw they also had anterior pelvic tilt. That's this. Anterior pelvic tilt, okay? That's it. Just kind of the butt out like that. That's what we mean by that. So there was that kind of compensation here to get down, or this to get down, or even both. They also found, specifically, they wanted to compare in the results, the women versus the men, okay? So now let's go back. In the people that they included in here, of the 20 who had the hip pain, 11 were male and 9 were female, okay? So, and a lot of these people, a good majority, had involvement in sports. It honestly was so broad across the board with like all different types of sports, and they had played it within the last 12 months. So it was just a lot of sports. They didn't get into dancers at all in this, but if you still have this injury, it's still something to consider, this study, okay, if you have this kind of hip impingement going on. Okay, so between the males and female, they found that actually the women had more stuff going on, more compensations to try to do it, aka weaknesses. So they saw that the women compared to men had more hip flexion. They had more hip adduction. So let me go up on releve so you can see. That means bringing the leg in. So they brought the hip in more, okay? So they had hip in more. They also did the anterior pelvic tilt more compared to the men. There was more of a pelvic drop compared to the men. And then also, aside from this going in, the thigh went in as well. So we had everything coming in towards the knee. That is a good thing to note. Now, here's the deal. They concluded from this that there is definitely an altered movement in people who have femoral acetabular impingement, this type of hip pain, when during a step down, and it may be also contributing to the continuous of the hip pain, the continuity of the hip pain. I just realized that I didn't put this mic on, so this is probably where you'll hear me a lot better, but fortunately I speak loud, so it was okay before. We'll see. Oh my gosh, live video. This is hysterical. Anyway, so also another thing that, aside from the hip pain, they can't really conclude at this point that women have more of this going on than men. It's such a small group of people. They selected them. It was across the board, different sports, different backgrounds. You got to get more specific. Though this was, I think it's a good study. I'm glad they did it. I'm glad that they started looking at, during this specific movement, stepping down, different things that they saw going on movement quality wise. I think that's great. It's good to see that. However, now we need to get more specific. If we're going to look at soccer players, we're going to look at soccer players. If we're going to look at musical theater dancers, we're going to look at musical theater dancers. If we're going to look at modern dancers, we're going to look at modern dancers. If we're going to look at touring musicians who are sitting all day and playing their instruments, let's look at touring musicians who have, I think it would also be good to look to see what their physical schedule, who works out, who doesn't, and stuff as well. So you need people with similar backgrounds to you to fully compare this to you. However, this is something to take note of. Do you find, and what you can do is you can videotape yourself. You can do this. You can have somebody videotape you stepping down from a step. Just go to a stair, step down, have them videotape you from the side and videotape you from the front, and compare both sides. Also keep in mind where you have certain things going on in your body and stuff. I'm not making you be a physical therapist. I'm teaching you how to better get to know your body. And everything that I just listed here that they looked at in the study, see if you're doing that yourself. Don't try to fix it. Just step down. You can slow down the video when you go back to look at it. There's a lot of apps to do that. So you have that as an option. But that's how you can apply this to yourself. What good is this? Is this going to really do to help you go, oh, you know, women are weaker than men, but we can't really conclude that, or there's altered movement if you have hip impingement. That's great. You know, you could have hip pain, but maybe it's not necessary. You may not have it. We can't say big picture. There's such a small group of people that they looked at. However, this can be a good light bulb for you, a good light bulb of opportunity to better get to know your body, better care for yourself, and make sure you're seeing a physical therapist. So that way, everything you are doing is even on both sides and also done properly to avoid further pain. That is it. If you have any questions, feel free to reach out. I hope the beginning part of this video audio was great. We'll see. I'm going to listen back at once I saw this. This is just a fun day. You know what? We're about to get into Thanksgiving. It's fine. Capiche.